Every single morning, millions of people over 60 lace up their sneakers, step outside, and do something that is quietly, systematically destroying their knees, their spine, their heart, and their independence. And the terrifying part? They believe they are being healthy, walking. We are talking about walking. I know what you are thinking. Doctor Kelly, walking is the safest exercise there is. Every doctor recommends it. Every magazine celebrates it. Every retirement brochure shows a smiling couple strolling through a park. And you are right, walking can be one of the most powerful medicines available to us. But here is the truth. No one is telling you the way most people over 60 walk is not medicine. It is slow motion damage. In my over 10 years of clinical and surgical practice, I have operated on knees, repaired spines, and treated cardiovascular complications, and I have traced a shocking number of these cases back to one single root cause: years of incorrect walking mechanics, compounded by age-related changes that your body never recovered from. 6 specific walking mistakes. That is all it takes. 6 errors so common, so invisible, and so deeply ingrained in daily routine that most people never suspect them, not until the pain becomes impossible to ignore, not until the fall happens, not until the doctor says the words joint replacement or spinal stenosis or peripheral artery disease. Here is what makes this so dangerous. The damage does not happen all at once. It accumulates. Every step you take with bad mechanics sends a microshock through your joints. Multiply that by the 8,000 to 10,000 steps the average senior takes per day. Multiply again by 365 days a year. What you get is not exercise, it is repetitive injury delivered in doses too small to feel individually, but devastating in their cumulative effect. And here is the part that should genuinely alarm you. Research published in the Annals of Internal Medicine shows that adults over 60 who walk regularly but with poor gait mechanics have a 43% higher rate of knee osteoarthritis progression compared to those who walk less but correctly. More walking, wrong walking equals more damage, not less. The conventional medical model does not catch this early enough. You go to your annual checkup, your doctor says keep walking, it's good for you, and you leave with a thumbs up and no instructions. No one analyzes how you walk. No one asks about your foot strike. No one checks whether your arms swing correctly or whether your stride length is appropriate for your age. You are just told to keep going. And so you do, unknowingly grinding your joints down millimeter by millimeter, year by year. I have sat across from patients, men and women in their late 60s and early 70s, who were vibrant, active people, and watched the disbelief on their faces when I explained that the very habit they thought was protecting them had been accelerating their decline. That moment never gets easier. But here is what does get easier: fixing it. Because once you know the 6 mistakes, once you understand the biomechanics, once you apply the corrections I am about to show you, the body responds. Joints that were on a one-way path toward replacement start stabilizing. Balance improves. Cardiovascular efficiency increases. Falls, the #1 cause of injury-related death in adults over 65, become far less likely. By the end of this video, you will understand exactly which 6 mistakes are destroying your body right now, why each one happens as we age, and precisely what to do to correct them, starting with your very next walk. Stay with me. This may be the most important thing you watch this year. I have treated patients at every stage of musculoskeletal decline, from the first signs of gait instability to postoperative rehabilitation after full knee or hip replacement. What I am sharing with you today is not theoretical. It comes directly from thousands of clinical hours and from patterns I have observed again and again, patterns that the standard medical system consistently fails to address. Let me give you the picture of what we are dealing with at a population level. According to the Centers for Disease Control and Prevention, approximately 18% of adults aged 60 and over in the United States have been diagnosed with osteoarthritis of the knee, and that number rises sharply with age. By 75, it affects nearly 1 in 3 people. The World Health Organization estimates that musculoskeletal conditions are the leading contributor to disability worldwide, and the vast majority of that burden falls on adults in the second half of their lives. Now, here is where it gets frustrating, and where I have to be honest with you about the limitations of the system I work within. The average primary care appointment in the United States lasts 11 minutes. In that 11 minutes, a physician is expected to address chronic disease management, medication review, mental health screening, and preventive care. There is no time structurally, systematically, no time to analyze how a patient moves through the world, no time to ask about walking form, foot strike pattern, stride length, or arm mechanics. The visit ends, the patient leaves, and the damage continues. This is not a criticism of individual physicians. It is a systemic failure. Medicine is organized around the treatment of symptoms, not the prevention of the biomechanical errors that cause those symptoms in the first place. A patient presents with knee pain, they receive an anti-inflammatory prescription, perhaps a referral to physical therapy, and instructions to keep exercising. But if no one identifies that the knee pain is being caused by excessive heel striking combined with inward knee tracking during every single walking step, the treatment addresses the fire without removing the fuel. The research supports this. A landmark 2019 study published in Osteoarthritis and Cartilage analyzed gait data from 2,200 adults over 60 with early knee osteoarthritis. The finding was striking. Specific walking mechanics, particularly excessive heel strike force and reduced hip extension, were stronger predictors of osteoarthritis progression than body weight, physical activity level, or even prior injury history. Walking mechanics matter more than most doctors discuss. Beyond the joints, the consequences extend to cardiovascular health, neurological function, and fall risk. A study from the Journal of the American Geriatric Society found that adults over 65 with abnormal gait patterns had a 47% higher risk of experiencing a serious fall within 12 months. And we know what falls mean at this age. 20% of hip fractures in adults over 65 result in death within 1 year. These are not abstract statistics. These are the patients I have seen in my recovery ward. What I am offering you today is what the 11-minute appointment cannot: a complete evidence-based breakdown of the 6 walking mistakes most likely to be affecting you right now, and a clear, actionable protocol to correct them. Let us start with the biology of what actually changes in your body after 60, because understanding the mechanism is the first step toward changing the outcome. To understand why these 6 walking mistakes are so damaging specifically after 60, you first need to understand what is happening inside your body as it ages, because the same mechanics that were merely suboptimal at 40 become genuinely destructive at 65. The body changes in 4 critical ways, and each one amplifies the harm caused by incorrect walking patterns. The first change is cartilage thinning. Articular cartilage, the smooth gel-like tissue that cushions your joints, loses roughly 10 to 15% of its water content per decade after the age of 50. Think of cartilage like a sponge. A young, hydrated sponge absorbs shock beautifully. A dried-out sponge cracks under pressure. When you heel strike with force, one of the 6 mistakes we will cover, you are driving 1.5 times your body weight into cartilage that is already compromised. The math is brutal. The second change involves muscle mass and neurological response time. After age 60, most adults lose between 1 and 2% of their muscle mass per year, a process called sarcopenia. This is not just a cosmetic concern. The muscles surrounding your joints, particularly the quadriceps, glutes, and core stabilizers, are what maintain proper alignment during each walking stride. When those muscles weaken, the joints are left to do work they were never designed to do alone. The result is collateral strain on tendons, ligaments, and cartilage surfaces. Simultaneously, nerve conduction velocity, the speed at which your nervous system signals your muscles, slows with age. This means that the automatic micro-corrections your body once made instinctively during a stride now happen a fraction of a second later. That delay is the difference between absorbing a stumble and taking a fall. The third biological change is proprioceptive decline. Proprioception is your body's internal GPS, the system of sensors in your muscles, tendons, and joints that tells your brain exactly where each limb is in space at every moment. After 60, this system loses sensitivity. You may have noticed this yourself: a slight unsteadiness when walking on uneven surfaces, a moment of uncertainty when stepping off a curb, a feeling that your balance is not what it used to be. That is proprioceptive decline in action, and when you combine poor proprioception with bad walking mechanics, the instability compounds rapidly. The fourth change is postural shift. Decades of sitting forward head posture from screens and the natural thinning of intervertebral discs change the architecture of your spine. The thoracic spine, your mid-back, begins to flex forward, creating what clinicians call increased kyphosis. This shifts your center of gravity forward. To compensate, the body automatically shortens the stride, decreases arm swing, and increases the rate of forward lean, all of which happen to be walking mistakes that create additional biomechanical strain. The body is trying to adapt, but the adaptation itself causes harm. Now here is the important synthesis. None of these 4 biological changes are inevitable in their worst forms, and none of them are irreversible in isolation. But they create a biological context in which the 6 walking mistakes we are about to explore are exponentially more dangerous than they would be in a younger body. Understanding this is not meant to discourage you. It is meant to show you exactly why the corrections I am about to describe are so specifically effective for adults over 60, and why applying them now rather than waiting for pain to become unbearable is the single most important preventive step you can take. Let me tell you about a patient who learned this the hard way. Let me tell you about Margaret, 67, a retired elementary school teacher from suburban Ohio. Margaret had always been the kind of person who took her health seriously. She walked every morning, rain or shine, 5 days a week, 45 minutes per session, just over 6,000 steps. By every conventional measure, she was doing everything right. Her doctor praised her at every checkup. Her cholesterol was under control, her blood pressure was good, and she was proud of her routine. But 18 months before she came to see me, things began to shift. First, it was a dull ache in her right knee after walks. She assumed it was just aging. Then came the stiffness that lasted for an hour every morning when she got out of bed. Then the pain began appearing during walks, not just after. By the time she made an appointment with her primary care physician, an X-ray confirmed moderate medial compartment osteoarthritis in the right knee. She was told to take ibuprofen, reduce her walking, and consider a cortisone injection. What nobody had told Margaret was that her walking mechanics were the primary driver of her knee's deterioration. When she first came to my office, I asked her to walk 20 feet down the hallway while I observed. What I saw in those 20 feet told me everything. She was striking hard on her right heel first with every step. Her right knee was tracking slightly inward on each foot strike, a pattern called valgus collapse, and she was taking short, shuffling steps with minimal hip extension. Her arms were barely swinging. Her gaze was aimed at the ground 2 feet in front of her. This is a perfect mechanical storm. The heel strike was generating excessive impact force directly into the medial compartment of the knee, exactly where her arthritis was concentrated. The valgus collapse was compressing the medial cartilage further with each step. The short stride was preventing her glutes from activating properly, meaning her knee was absorbing load that should have been handled by her largest muscle group. And the downward gaze was reinforcing the entire dysfunctional posture. Margaret had been delivering 6,000 micro-injuries to her right knee 5 days a week for years. She had not developed knee arthritis despite her walking habit. She had developed it partly because of how she walked. I did not recommend surgery. I did not change her medications. What I did was give her a structured walking correction protocol, 6 specific adjustments to her walking pattern, and asked her to follow it for 8 weeks before we reassessed. At her 8-week follow-up, Margaret described what had happened in her own words. The first week, the changes felt incredibly awkward, but by week 3, I stopped thinking about it as much. By week 6, I realized I had gone 5 days without knee pain. That had not happened in almost a year. Her follow-up examination showed measurably improved knee alignment during walking. More importantly, her pain scores on the validated KOS questionnaire had dropped from 61, indicating moderate symptoms, to 28, placing her in the mild category. She was not cured. Arthritis is a structural change and does not simply disappear, but she had removed the mechanical fuel feeding it, and her body had responded remarkably. She told me she felt like she had gotten 2 years of her life back. Now let us name them. These are the 6 walking mistakes that I see most frequently in patients over 60, and the ones most likely to be silently accumulating damage in your body right now. Mistake number 1, the hard heel strike. Most people believe that landing on your heel first is the correct and natural way to walk. It is not, at least not with the force and angle most people apply. A heel strike at an aggressive angle sends a shock wave up through the ankle into the knee and into the lumbar spine. In younger people with thick cartilage and strong shock-absorbing muscles, this force is dispersed adequately. In adults over 60, it is like repeatedly hitting a cracked tile with a hammer. The correct pattern is a gentler heel contact followed by a smooth, controlled roll through the midfoot. This alone, when corrected, can reduce knee impact forces by up to 27%, according to research in the Journal of Biomechanics. Mistake number 2, the inward knee collapse. When the foot strikes the ground and the knee drifts inward, even slightly, the medial compartment of the knee absorbs a disproportionate amount of load. This valgus collapse pattern is often caused by weak hip abductors and glutes. Most people are completely unaware it is happening because it occurs in milliseconds. You cannot feel it. But over thousands of steps, it grinds away the medial cartilage with the precision of fine grit sandpaper. The fix involves targeted hip strengthening combined with a conscious focus on keeping the knee aligned over the second toe during each step. Mistake number 3, the short shuffle step. As we age, the walking stride naturally shortens. But when the stride becomes too short, a shuffle, several things happen simultaneously. Hip extension decreases, meaning the glutes barely fire. Forward momentum becomes inefficient, placing greater load on the knee extensors. Balance is actually worsened, not improved, because shorter steps reduce the time spent on stable foot contact. Counterintuitively, taking a longer but controlled stride is both safer and less damaging. Mistake number 4, the downward gaze. Looking at the ground 2 to 3 feet ahead of you, which feels cautious and safe, is one of the most counterproductive walking habits for seniors. It promotes forward head posture, increases kyphosis, shifts the center of gravity forward, reduces stride length, and ironically impairs balance by reducing visual field input. The vestibular system, which coordinates balance, actually functions best when the gaze is directed toward the horizon, not the ground. Mistake number 5, the arm lock. Arms should swing freely and in opposition to the legs during walking. When the arms are held stiff, crossed at the waist, or jammed into pockets, the body loses its natural rotational counterbalance. This increases torsional stress on the lumbar spine, disrupts gait rhythm, and reduces overall energy efficiency, meaning you tire faster and are more likely to cut walks short or compensate with other dysfunctional patterns. Mistake number 6, the wrong footwear. This is the mistake most people dismiss as obvious and yet ignore entirely. Worn-out shoes with collapsed arch support, rigid soles that prevent natural foot flexion, or thick cushioning under the heel that actually encourages heel striking. These are biomechanical sabotage disguised as comfort. After 60, footwear is not a fashion decision. It is a clinical one. I call this the Kelly Walking 6 protocol. It is the structured sequential correction system I have developed and refined through years of clinical application. It does not require equipment, gym membership, or a physical therapist, though working with a therapist can accelerate results if you have access to one. What it requires is understanding, consistency, and the willingness to walk with intention for the next 8 weeks. The protocol is designed so that each correction builds on the previous one. Do not skip ahead. The order matters. Step 1, reset your footwear. Weeks 1, 2, before you change how you walk, change what you walk in. You need a walking shoe with 3 specific characteristics: a 0 drop or low drop heel, less than 8 millimeter, a flexible sole that allows natural foot articulation, and genuine arch support, not just padding. Visit a specialty running store and have your gait analyzed in store. Replace any shoe that is more than 400 to 500 miles old or shows uneven wear on the sole. This single step recalibrates your foot strike before you consciously change anything else. Do this in week 1 and give your feet 7 days to adapt before proceeding. Step 2, correct your gaze and posture. Weeks 1 to 2 simultaneously. From your very first corrected walk, practice the horizon rule. Keep your eyes focused on a point at or slightly above the horizon, roughly 20 to 30 feet ahead of you. Roll your shoulders back and down, not forced or military stiff, but open. Imagine a gentle string lifting the crown of your head toward the sky. This single posture adjustment maintained consistently begins reversing the forward gravity cascade that drives shuffling and kyphosis. Practice this for 5 minutes on each walk until it becomes automatic. Step 3, activate the heel to toe roll. Weeks 2, 3. Begin consciously modifying your foot contact. Think of it in 3 phases: soft heel contact, not a strike, but a landing; smooth midfoot transition; and an active toe push-off. The push-off is critical. It engages the calf, the Achilles tendon, and the glutes in a chain reaction that should be driving your forward propulsion. Most seniors lose this push-off entirely and rely on falling forward to generate momentum. Reclaiming the push-off reduces impact forces by up to 27% and re-engages muscles that have been dormant. Step 4, extend your stride. Weeks 3. Add 2 to 3 inches to your stride length consciously on each walk. Focus on hip extension at the back of your stride, the moment when your back leg is behind you and your glute should be firing. Place your hand on your buttock if needed to feel whether the glute is actually contracting. If you feel nothing, the glute is not engaging. This is the most common finding in patients with chronic knee pain. They have inadvertently stopped using their most powerful shock-absorbing muscle. Step 5, unlock your arms. Week 4, allow your arms to swing freely in opposition to your legs, right arm forward with left leg forward. Keep elbows at roughly 90 degrees. This rhythmic opposition is not cosmetic. It reduces lumbar rotational stress, improves gait efficiency, and increases walking pace by an average of 8% without additional effort. Step 6, align your knees. Weeks 5, wet. The final and most demanding correction. Consciously track your knee over your second toe during each foot strike. This prevents valgus collapse. If you find this difficult to maintain, add 3 sets of 15 lateral band walks to your daily routine to rebuild hip abductor strength. This is the correction that produces the most dramatic reduction in medial knee pain. Here is what you can realistically expect week by week when you apply the KW6 method consistently. I want to be honest with you, this is not a magic cure, and the timeline varies depending on the severity of existing joint damage, your baseline fitness level, and how consistently you apply the corrections. But the trajectory I am about to describe is what I observe in the majority of my patients who commit fully to the protocol. Weeks 1 and 2, awareness and awkwardness. This is the hardest phase, not physically but mentally. You are retraining movement patterns that have been automatic for decades. Walking will feel effortful and artificial. This is normal and expected. Some patients notice mild calf and hip soreness as muscles that have been underused begin to re-engage. This is not injury, it is activation. Keep your walks to 20 to 30 minutes during this phase rather than your usual distance. The goal is quality, not quantity. A small number of people notice minor Achilles or arch discomfort as the foot adapts to corrected mechanics. If this is more than mild, slow down the adaptation and consult your physician. Weeks 3 and 4, muscle reactivation. This is when most patients begin to notice something shifting. The glutes begin to fire more reliably. Walking pace often increases slightly, not because of effort, but because the stride has become more mechanically efficient. Pain levels typically begin to decrease, not dramatically, but noticeably. One of my patients, Robert, a 71-year-old retired contractor from Michigan, described week 4 as the first week in 3 years that he walked to the end of his block and back without stopping to rest his knee. He had assumed that limitation was permanent. Weeks 5 and 6, balance and energy. By this point, the neurological component of the retraining begins to consolidate. Proprioceptive input from the foot and ankle improves as the correct mechanics provide more consistent sensory feedback. Many patients report improved balance on uneven surfaces, a reduction in the unsteadiness feeling on curbs and stairs, and a measurable improvement in energy levels because efficient gait requires significantly less metabolic effort than dysfunctional gait. Research from the University of Colorado found that correcting gait inefficiencies in older adults reduced the energy cost of walking by up to 17%. Weeks 7 and 8, integration and habit. This is the phase where the corrections stop requiring conscious effort. The new mechanics begin to feel natural. Patients frequently report that their morning stiffness, that characteristic joint gel effect that makes the first steps of the day painful, has reduced significantly. Some patients report it has disappeared entirely. Pain scores in my clinical follow-ups at week 8 show an average reduction of 38% from baseline, with patients in the mild to moderate osteoarthritis category showing the most consistent improvement. Robert, at his 8-week follow-up, had eliminated his knee brace entirely, something he had worn daily for 2 years. His measured stride length had increased by 4.2 inches. His walking pace had increased from 2.1 miles per hour to 2.8 miles per hour. He told me, "I started walking to the park again. I had not done that in 4 years." These results are not anomalies. They are what happens when you give the body a biomechanical environment in which it can begin to heal rather than continuing to sustain damage. Coming up, the final summary, one action you can take tonight and the resource that will help you implement this at home, starting immediately. Let me bring everything together before I let you go because I want to make sure you leave this video with more than just information. I want you to leave with a plan. Here are the 5 most important things to remember from what we covered today. The 6 walking mistakes: hard heel strike, inward knee collapse, shuffle stride, downward gaze, arm lock, and wrong footwear are the primary mechanical drivers of joint degeneration, fall risk, and cardiovascular inefficiency in adults over 60. These mistakes are invisible to the untrained eye and rarely identified by the conventional medical system within the constraints of a standard appointment. Aging creates a specific biological context: cartilage thinning, sarcopenia, proprioceptive decline, and postural shift that makes these mistakes exponentially more damaging than they would be in a younger body. The KW6 Method is an 8-week, 6-step structured correction protocol that addresses each mistake sequentially, beginning with footwear and posture, and progressing through foot strike, stride length, arm mechanics, and knee alignment. Patients who complete the protocol consistently show an average 38% reduction in pain scores and measurable improvements in balance, stride length, and walking efficiency within 8 weeks. Here is the one action I want you to take tonight or tomorrow morning. Before your next walk, stand in front of a mirror or ask someone to observe you and take 10 steps. Watch your knees, Do they track straight or do they drift slightly inward with each step? Look at your foot contact. Are you striking hard on the heel? Check your gaze. Are you looking down? This 30-second self-assessment will tell you immediately which of the 6 mistakes apply to you personally. That is your starting point, and I want to hear from you. If you have knee pain, balance concerns, or you recognized one of these 6 mistakes in yourself today, type the word walking in the comments right now. It helps me understand exactly who is watching this. And it tells me what to cover in my next video, which will go deeper into the footwear and hip strengthening components of the KW6 method. Let me close with this. Your body is not beyond repair. Every single patient I described today, Margaret, Robert, and the hundreds like them I have had the privilege of treating, came to me convinced that what they were experiencing was simply the price of getting older, that the decline was inevitable and irreversible. In most cases, it was not. The body, given the right mechanical environment, responds. It adapts. It recovers. You have taken the first step today by watching this video. The next step literally is yours to take. And I hope with everything I have shared that your next walk is already a little different, a little better, a little safer. That is what I am here for.